Member for Clark.
We didn't even go near the question.
No.
Thank you, Mr Speaker. My question is to the Premier in his capacity as Minister for Health. Premier, just last week I was confronted by a very distraught mother of a 4-year-old who said she contacted the Child Health and Parenting Services, or CHAPS as we all call it, to book a Healthy Kids check that is supposed to be available for all 4-year-olds. Imagine my surprise when my distressed constituent told me the CHAPS were not taking appointments for 4-year-olds. This is the assessment that, I'm pretty sure, all the parents here would have arranged for their own children. Like me, you would have your child's blue book tucked away with all the assessments recorded from birth to 4 years. It's invaluable because it gives parents confidence that their child has reached the required level of cognitive and physical development before they start kinder. I rang the booking number myself and was confronted with a recorded message that CHAPS was prioritising appointments for babies with only some capacity for older children. Premier, do you agree that assessments for 4-year-olds are essential to address any concerns about a child's growth so parents can be confident their child is doing the things expected of them for their age? And Premier, will you ensure that CHAPS is adequately resourced so that it will provide assessments not just for babies but for all children at 12 months, 2 years and 4 years?
Honourable Premier.
I won't blame the previous government for that.
Yeah, failing kids now.
Order.
I thank the honourable member for the question and interested to talk to you more about an exact example,
It's
Mr
across
Speaker.
the state.
Our government, of course, is committed to the wellbeing of children and young people and investing some $100 million, Mr Speaker, over 4 years as part of our child and youth wellbeing strategy. Our Child Health and Parenting Service, as the subject of the question, Mr Speaker, is a community-based service providing early childhood health services to parents, infants and children between 0 and 5 years of age.
Well, not at the moment.
The CHAPS service provides a range of child health services including growth and developmental screening and surveillance assessments, parenting support, breastfeeding, sleep and setting and postnatal care, Mr Speaker. CHAPS works in partnership with local communities through schools, child and family learning centres, neighbourhood houses, members would know, and local organisations. An additional $350,000 per annum has been allocated to CHAPS to extend the scope of the Tasmanian Child Health and Parenting Service, and this additional funding will provide staff to support vulnerable parents during their first 1,000 days, which has been identified as a focus area in Tasmania's Child and Youth and Wellbeing Strategy, Mr Speaker. In relation pertaining to the question more directly, I'm advised that currently there are some staffing challenges that are being experienced, Mr Speaker. Recruitment remains a priority focus for CHAPS and a range of initiatives are underway this year to boost the nursing workforce into the future. These include support for up to 14 part-time postgraduate student nursing training places across the state this year, with this initiative running alongside the postgraduate UTAS Child and Family Health Nursing course and development of a dedicated CHAPS workforce recruitment and retention plan. I'm advised that staffing appointments to the south and north continue to improve, with an ongoing focus on the attraction of staff to work in the northwest area of the state. Mr Speaker, I'm further advised that the service has maintained and strengthened capacity to use telehealth consultations to provide appointments to clients, allowing families to have important health-based early intervention and age-appropriate developmental assessments completed. Critically, Mr Speaker, advice will still be available for parents calling CHAPS with concerns about older children, with this provided by phone by a child and family health nurse. Mr Speaker, I thank that honourable member for her question. My answer provides some information for you. I thank the member for her question, and I'm interested to find more about the exact circumstances which your constituent detailed to you.
Mr Speaker.
Honourable member for